Dear domestic and foreign friends, I am excited to announce some achievements of our research in human body regenerative restoration science. From my point of view, this announcement is different from the others, in that this is the first time that human beings can formally announce a brand new science system other than medicine in the human life science system. This is the system of human body regenerative restoration science. Since the human civilization was recorded by the history, exploration and discovery of the human body life mystery has never stopped. We also get new thoughts and enlightenment from life science. And what is this enlightenment? It is to find the human body regenerative potential. As Mr. Liu said just now, we generally believe that such ability is the privilege of lower species of animals. But today we declare that high mammals do possess such ability, and moreover much stronger than theirs. More precision derived from evolution will result in more and perfect regenerative potential. The point is, it was not discovered by human beings before. The achievements I am going to announce are in situ somatic cell regeneration. I wish all of you can remember this concept, and then all the questions will be resolved. The in situ regeneration of somatic cells have been confirmed through experiments and is part of the life sciences, just as we mentioned. What are the methods of experiment? An accomplished science system consists of basic research and clinical study. What is an accomplished science system exactly? It must have application results. It is not a real applied science system without an application result. Nowadays, there are many confusing concepts. But anyway, they may be regarded as exploration. But are there any results that obtained from these concepts? If no, all of the concepts are just exploratory discoveries. What I am going to announce today is human body regenerative restoration science, which is an applicable science system that can be directly applied to the health of human beings. We handed out to everybody a book, Human Body Regenerative Restoration Science, but you may not understand it, since it includes announced achievements. So I would like to take 30 minutes to have a general explanation of the book. First of all, what is the science attributed of human body regenerative restoration science? To sum it up, it includes two parts. One is to restore the abnormal to the normal status, and the other is to achieve the rejuvenation of aging tissues and organs. It has been the dream of human beings for a long time. But how do we achieve it? And the answer is quite easy. We only need to take an extra regenerative substance with each meal. Then the human body's congenial regenerative potential can be activated by the regenerative substance. And regenerative cells are induced in situ. What will these regenerative cells do? They act to replenish damaged and/or diseased cells, and replace aged cells and activate regenerative restoration. Please do remember this term, regenerative restoration, which may sound a little bit complicated. But when you review the phases, restore the abnormal organs into normal status, this is regenerative restoration. And to replace aging cells with regenerative cells means rejuvenation. Today, it's my first time using the term rejuvenation, which is not easy. As we all know, it has been a fairy tale and dream of human beings for a long time. But today, we announce the results of achieving regenerative restoration. Before this announcement lecture, I have been struggling whether or not to use this term. Herein, I can announce for sure that the rejuvenation ability and mechanism lies in every human body, which is regeneration. Well, let's take a look at the current research of rejuvenation and restoration of the abnormal organs into normal status. What is the kind of research like in the world? It shares the same study scope in the hopes of prolonging lifespan and rejuvenation, which is an ideal. In the research of life science, scientists have always been exploring whether 100-year in the longest expectancy of human lifespan. But eventually, how long is it supposed to be? There is a common concept. After the theory of telomere was established, it is this kind of development that turns the dream into an actual reality and lets people believe that human lifespan is definitely not 100 years, but more than that. That is the theory of telomere. What is the telomere? The telomere is just like two caps on the top of each chromosome, which is the red part on the picture. According to the telomere theory, The telomere shortens as a person ages. However, when we live for 100 years, the telomere is only reduced by 1/3. Therefore, people can imagine there is a possibility that we may live longer for 200 more years, additional 200 years. How can we live for 200 more years? So many specialists in the field of genetics and other areas are all exploring this mechanism. Someone says that human beings can live for 1,000 years or 500 years, but today we have confirmed through our animal experiments that a human being can at least live for 300 years. This is one concept. The other one is the theory of rejuvenation also resulted from telomere repair. We experts who engage in cancer cell research may know that a damaged telomere will soon be repaired by telomeresis. So cancer cells grow quickly, but its telomere never decreases, which is the reason why cancer cells are called immortal cells and can live an immortal life. Certainly, growth of human beings is just like crop growth, which also undergoes the process of immaturity to maturity. But how long will it take? We say that it will take 300 years. Besides, we need to know what the current situation in this field worldwide is like. We may have accessed it through newspapers and news reports. But what is the current status of modern science applications of human beings? The current science status of human beings is that people are still waiting for the application results. And until now, there are few results that can be applied clinically. But our human body regenerative restoration science has already gotten some results, which I will show you today. We used animal experiments to mimic human beings. We chose male rats of 300 days of age, and they were fed with, at 300 days old, and achieved a lifespan 3 times the normal length and remained non-aging when, at twice the usual lifespan. Another trial is the 5-year application study resulting in human beings. As Mr. Shao mentioned just now, he is one of those volunteers for regenerative restoration. He did not reach 5 years. And he has achieved regenerative restoration. Another achievement is trauma repair, disease treatment, and rejuvenation. Now let's look at the results. This is the study results of rats. The average lifespan of the rat is 480 days. We began to feed at 300 days. After regenerative feeding, at 820 days old, which is equivalent to a doubled lifespan, the rats were sacrificed and historical changes were checked. What are the historical changes? All organs remained at non-aging. As Mr. Liu just said now, professors from Peking Union Medical University did double-blind experiment, and they were only in charge of interpreting the tissue section and did not know where the rats came from, so this is totally one-to-one testing. In the end, they were astonished by our results. They thought that the rats of doubled lifespan age were young rats, and the rats of normal lifespan age were older rats. They were all surprised when we announced the results. All the things were reversed. The rats of doubled lifespan age fed with regenerative substances showed young a historical profile, while the rats of normal lifespan age fed with a normal diet showed an aged historical profile. This is the technology of human body regenerative restoration. All organs such as the heart remained at a non-aging status. So when Mr. Liu came to my office for the first time, he wanted me to test at first. Mr. Liu said, "Would you show me any solid evidence?" I said, "I have already have some evidence." When I presented these, Mr. Liu asked, "Is it true?" I said, "Absolutely. It is the result of a double-blind test. If you do not believe me, you can investigate." And then I even recommended Mr. Liu to ask my cooperators at Peking Union Medical University, where he has many close friends or followers. When he investigated them, they presented him some material. All the tissue sections of our study are stored in Peking Union Medical University, so all the materials are original. If rats can achieve this, what about human beings? That leads us to the following results. What are the results of human beings? Their appearance remains unchanged, or they even look younger. Their energy, spirit, vigor, and strength are thriving. Moreover, as Mr. Shao just said right now, I am here right now full of energy, spirit, vigor, and strength. Mr. Shao has also won the awards of longest distance twice consecutively in golf competitions. And from this we can see his improvement of the strength of his arm and body and overall changes. What's more, the intractable conditions are also decreasing. Next, let's take a look at this group. As shown in this picture, appearances remain younger instead of older. In this picture, the contour of the face is round. There is a significant difference between the appearances before and after the regenerative restoration treatment. Let's look at another group. Obvious changes are seen, and we can also see the appearance now is younger than before. This is not reversal of the two pictures. This is also one of our volunteers before regenerative restoration, and actually all of us can have regenerative restoration like that. This group of pictures is from old people before and after regenerative restoration, which shows great changes. This group of pictures is from the Director of Science and Education Division of the Ministry of Health, and showed the comparison of his picture taken before he began the regenerative restoration and the picture taken after 5 years of treatment. He is out of China now because of business, otherwise he would have also given us a speech and shown the power of the science. This group of faces pictures is from Mr. Xiao. Changes of facial form has nothing to do with cosmetology. This is not cosmetology. Indeed, it is regenerative restoration, which makes the whole muscle layer and other organs rejuvenate. The next group of pictures is from me. I am also one of the volunteers, and all of the changes are just like the others. This picture was taken when I was 48 years old. I am here right now, so you can tell which one appears older. Again, this is a picture of my face. Now you can see my face is just like that. And there the changes are obvious. This change is not an effect of cosmetology, nor the concept of cosmetology, which only changes the epidermal layer. Regenerative restoration treatment can restore all the tissues and organs outside the bone back into a younger status, and this is the human potential. I didn't make such an announcement 5 years ago, but now I have decoded the mechanism of rejuvenation, and all of our volunteers have rejuvenated. This is totally true, and you can see the difference on my face. And there are still many shocking results. The same regenerative restoration results are obtained from all of the volunteers. Then how does one achieve regenerative restoration and rejuvenation? Definitely everybody wants to know the answer. Actually, it is quite simple. Just as Mr. Liu mentioned above, I built up my career from burnt treatments. I found that if a wound with skin and bone defects can regenerate new skin during burn treatments, then all the other organs can also be regenerated. That is the mechanism model of human body regenerative restoration. Another mechanism model is that we resolve the problem of scar formation, which means fibrotic tissues is removed and regenerative cells replaced the fibroptic cells. The reason human beings age is because cells stop proliferating at a certain point and change into fibrotic cells. Organs will age when cells become fibrotic. Thus, models derive from practice but not imagination. I am making good use of this chance to decode the mechanism. How does one implement regenerative restoration and rejuvenation? This is what everyone wants to know, and is more concerning today. First of all, we should know what the regenerative substance is. We have said that we should eat it, but what exactly is it? Firstly, we should know how to activate the human body regenerative potential. Secondly, how does one restore tissue organ defects? All of you may not be concerned about this point, but doctors are surely concerned about it. Thirdly, how do you regeneratively restore intractable diseases which cannot be cured by medical methods? Fourthly, everyone ought to know the rejuvenation of tissue organs. Everybody should not be superstitious in the regenerative substance announcement today. We did not create any new ingredients, new drugs, or new chemical compositions, but we only reprocessed our daily meals into something that can activate our regenerative potential. It would be unnecessary to explain, and we could easily get regenerative restoration if food from nature can activate regenerative potential. That is why we need to extract it from our daily meals. How does one extract it? We extract it by depending on cell culture to transform into tissue organs, which was announced in 2002. Until now, there are few in the world can achieve it. We have begun a series of experiments to get a regenerative nutrition spectrum. In other words, we have known the secrets of what cells should be fed and transform the secrets into a spectrum. Then, according to the spectrum, we calculate and code each ingredient to finally form regenerative substances. The regenerative substance is something people can take daily and even is a must for people to have daily meals in the future. We use 3 models to accomplish the process. Since most of us here are not the professionals, I will explain the process briefly. First is the model of somatic cells. We use somatic cells, not the stem cells. Somatic cells are derived from the intestinal epithelium, which are cultured into tissue cells and transformed into stem cells and then into tissues and organs. Nobody else in the world has achieved such a result. Some has just finished part of it in picture 6. In 2002, I announced the achieved results, but everyone said that it was impossible. However, all of the studies and research around the world now are following our routes. The scientist who cloned Dolly, the sheep, also declared that he began to focus on transforming somatic cells into stem cells, instead of reproducing cloning. All of them have few results, but we have achieved it. Through this, we get a nutritional spectrum which is like a prescription. It is also like cooking, where we know what to cook with various raw materials. The other model is tissue organ regeneration from tissue explants. Nobody else has achieved it. We directly culture organs and detect the nutrients required during tissue organ regeneration and establish a nutritional spectrum. This is the second kind of spectrum. The third spectrum is obtained directly from the human body. We take some human tissues in hospital operating rooms and culture the tissue organs in vitro. So we obtain three kinds of regenerative nutrition spectra by combining the results of animal experiments and human body experiments. These three spectras are also the foundation of regenerative substances for the human body. Making regenerative substances based on these spectra is a big project of nutriology and bromatology. In the future, one man's serving of food support three people. The diet became refined, which means we analyze the composition of regenerative nutrients and code it, and use these codes based on the spectra. Then what is the code? Each composition has a spectrum, and list every composition spectrum. Then we will see what the cells need during its life cycle, and in the end a coding is formed through computer programming. Take amino acids, for example. There are several amino acids in our human body. Besides non-essential amino acids, we have to obtain some amino acids that cannot be synthesized by our cells through intaking foods. Thus, we encode all kinds of amino acids and then the cell's needs, such as which is the first to be taken and which is the last to be taken, what the cells need when you are excited and what the cells need when you are sleeping. This is the code of amino acids. That is the code formation. So this is the process of code formation. I just introduced this concept today. I believe that scientists will soon make this dream come true. Ever since human beings were born, we have shared the same foods with animals. Animals eat goats and rabbits as food, and human beings are same as animals in that we also eat vegetables, pork, and mutton as food. The difference between animal and mankind is that mankind's food is more refined. But the next step is different, because we provide the essential foods. But now all of you have known the origin of regenerative nutrients. Indeed, the GIC and the elixir that our volunteers take are all derived through this process. But the core part is how to code, and this is our confidential technology. Regarding the ingredients, if any drug or non-nutrient element is found in my regenerative nutrients, then it's a fake one. It's not allowed. The reason is because the drug will bring problems, and the regenerative substance and drug work in different ways. As for the discovery of the human body regenerative potential, as I mentioned above, yes, we do have it. We originally found regenerative cells in a burn wound and announced it in 1989. It was called regenerative cells, because at that time the marker of skin stem cells have not been identified. Later, in 2001 or 2002, we identified and confirmed that these cells are keratin-19 positive stem cells, the ancestor of skin cells. The regenerative restoration of skin, fatty tissue, and subcutaneous tissue are all dependent on this type of cell. This gave me a big inspiration. If the largest organ of our human body, skin, has regenerative ability, then each of our organs can regenerate as well. This is the generality. The key is to decode every organ's mystery with our technology. This is the first time we uncovered the mystery. The effects of regenerative restoration are not only achieved in the phase of research or experiments, but in the clinical application worldwide. Nowadays, more than 20 countries introduced this technology. More than 40 million patients were treated by our technology. Skin with an extensive burn wound can be regenerated without scarring or disability, especially some. It looks really ugly, like a wounded skull with soft tissue and a bone defect. Look at the wound with a bone defect on the skull. How severe is it? The wound reached the endocranium as seen under an X-ray. The cerebrospinal fluid is just under the endocranium. Nevertheless, regenerative restoration can also be achieved on such severe wounds. The skull heals gradually under the effects of MEBT-MEBO. Though it has not healed completely, it will be very soon. If wounds like this can be regeneratively restored, then the scars or fibrosis inside the body is not a problem anymore. It is unnecessary to worry about your skin, especially for women, since it can be restored to a younger status. This is not cell rejuvenation, but turning your tissue back to normal, which is regenerative restoration. What is more shocking, multi-organs are able to regeneratively restore simultaneously. Take a severed finger as an example. Regeneration of a severed finger does not only include the skin, but also the many other organs and tissues that must grow simultaneously in order to maintain the integrity of the finger. Whether there is a concept of simultaneous growth in human body or not, it's what I want to explain today. The organs in the human body under the command of the brain can coordinate with each other and regenerate in situ, which is even superior to the lower animals. We should be excited about this. For example, a lizard will regenerate its tail if it is cut off, since there is a germinative layer in the tail, but this will not occur in lizard's claw. However, human beings can regenerate their limbs, which demonstrate the superiority of higher mammals. Okay, now, let's take a look at the regenerative of a severed finger. The finger palatum is one of the major human organs rich in nerves connected to the brain, and we have different sensations when touching with our hands, which is different from other skin areas, since the finger palatum can discern many things. Well, let's see how this finger regenerated. The severed finger, like this, grew step by step, but it will be shorter than its normal length because bone grows slower than skin tissues. It takes about 50 days to recover skin tissue, while it takes about 3 months for bone to recover. About 2 years later, it can recover to its normal physical appearance and function. In the case of a severed finger, the fingerprint can recover its normal pattern. In this case, the finger of the patient was bitten off and he resorted to taking the case to court. But defendant said his finger hadn't been bitten up. You see, the finger was severed, but it was regenerated by our treatment. The defendant actually committed crime in this case, but he had no idea that the regeneration occurred. This is called one-time direct healing. It is better for the common people to know little about medical treatments, as long as they know to smear the ointment in time to regenerate a severed finger. Once some debridement and disinfection are performed, the regenerative treatment efficiency of the ointment will be affected. See, this finger is broken from the nail base. It was replanted after injury and necrotized 6 days later. The wound was infected after necrosis. 11 days after we cleaned up the infectious area, the wound continued to recover. Yes, 11 days of regeneration, you see. The growth is very fast. At 22 days it healed. Though it healed, it was still defected because it was not as long as before. This is called incomplete regeneration. Why? This occurred because the wound was infected and the tissue did not grow synchronously due to the infection. What should we do? We must believe that our newborn finger body also has the regenerative potential. So, we innovatively tried to cut off the new finger body again to initiate secondary regeneration and promote its growth. This is the first time we tried it and we were successful. The defected part can grow, and the bone can grow gradually. This case tells us that their human fingers include all the tissues of a human body, such as the 4 tissues, epithelium, nerve, muscles, and connective tissue. They can grow simultaneously, and all other organs in our body can also do so. To tell you the truth, all the organs of the human body except the brain have achieved regeneration. That is why today I dare to give this announcement. This is the first lecture, and there will be many others later. We will announce the results of one organ after another. In fact, it is not difficult to achieve regeneration of brain cells, but there is a problem. There is no function with the newly regenerated cells. Why? It is due to the nerve fibers. There is no connection between cells. The brain is different from the other organs. For example, children have brains, but they don't have the knowledge of an adult. Just like the empty hard disk or floppy disk, there is no content. The inner content of brain cannot be connected, but I have confidence in overcoming this challenge. Since I have not overcome it now, I won't talk about it. But let's see another case in which the patient treated himself at home. What is the actual benefit to the public? It costs only 100 RMB to fix a severed finger. He needed 3 or 4 tubes of ointment, and 4 tubes of ointment only cost about 100 RMB. How cheap and simple. Our future regenerative supplements will be as easy to eat as your breakfast. One breakfast is enough for a whole day, which will greatly improve your quality of life. It is still ongoing. At the cost of 100 RMB, you can regenerate a finger at home. You can see these pictures of home treatment. So if the finger of your family member or neighbors are cut off, you have to try to use this ointment. Pay attention here. We need to clarify one concept. If only the muscle of the finger is cut off, it is not severed finger. The severed finger means the bone is involved. Injury without the bone involved is like a scald injury, which has been proved to be curable in practice. Intractable diseases mean the disease cannot be cured by current medicine. Though we have achieved a lot in medicine, there are still lots of problems that remain incurable. Chronic atrophic gastritis. What is chronic atrophic gastritis? The main pathogenesis is that the gastric tissue is replaced by intestinal tissue. Currently, there is no effective method to relieve or cure it. Because there is no effective treatment in science, these conditions are called intractable diseases. However, our treatment can handle these diseases successfully. It will only take 1 year to regeneratively restore the intestinal tissue in the stomach into normal gastric tissue. That is to say, this intractable disease can be cured. We have had a lot of such cases. Let's see this case. A historical picture shows chronic atrophic gastritis 8 months ago. After 8 months, the picture showed the normal state of the stomach. Intestinal tissues disappeared, which means no intestinal epithelialization occurred. Chronic atrophic gastritis is cured. Today, in this meeting, there are many experts of the digestive system. Results indicate that you can treat digestive diseases with a very good method. Other intractable diseases such as liver cirrhosis, resulting from fibrosis, and hepatitis of various kinds can be regeneratively restored. Now we will talk about the regenerative restoration of the liver. We spent 3 years achieving the regenerative restoration of a liver with cirrhosis. Let's see this case. The patient suffered from liver fibrosis for 30 years and splenox 7.3 centimeters under rib. Now the spleen has become a normal size and the biochemical functions indexes of livers have been completely regeneratively recovered. This is not the only case where the patient has achieved regenerative restoration. In our experiment consisting of 208 subjects, many of them achieved the regenerative restoration of the liver, and even other organs were restored after the treatment. Next, besides the intractable diseases, we can also treat cancers. Cancer tissues can be regeneratively restored, and cancer cells can also be replaced by regenerative cells. As shown in this picture, this is a cancer tissue, more specifically a skin cancer diagnosed by pathologic examinations. After regenerative treatments, cancer cells were replaced by regenerative cells. 22 days after beginning the treatment, cancer tissue recovered back to normal tissues. The cancer tissue disappeared and then skin organs regenerated. Let's take a look at another case. This cancer was cured after 20 days, so treating cancers is as simple as treating general wounds. Now we have set up a national medicinal network which makes the treatment more convenient. The only thing you need to do is smear Mebo ointment on the wound. As we all know, there are 2 types of skin cancer, squamous carcinoma and androcarcinoma. Today I didn't show you the pictures of androcarcinoma, but only the squamous carcinoma. Our technology has been applied routinely to treat these kinds of diseases for many years. So what I'm saying here is no longer news. Now we also use bone marrow regeneration to counter cancers, especially cancers with respect to blood cells, which originate from marrow. Our treatment is not to kill cancerous cells like chemotherapy does. What we do is regenerate new normal cells from bone marrow, which is the origin of blood cells, to replace the cancerous cells. On January 2008, we announced that we wanted to help the terminal cancer patients pass their last days since they have given up medical treatment. As for the result of this project, we will release them in detail later. Here, the certificate issued by the hospital and granted to those who have given up on their treatment when they were discharged is shown. After joining our project, we performed a diagnosis, assessment, and result analysis for these patients. This picture is examination report before bone marrow regeneration. We spent 3 months regenerating the bone marrow of the dying cancer patients. This picture is the examination report before bone marrow regeneration. This picture is the examination report after the bone marrow regeneration. Of course, once bone marrow recovers to a normal state, leukemia can be controlled. This is a simple truth. Minister Shao was diagnosed with CLL. CLL developed even more slowly. But we need believe that we will be able to replace the cancerous cells with the new regenerative cells through our regenerative restoration science and technology. More and more regenerated normal cells indicate the gradual recovery of normal marrow. The marrow are completely regeneratively restored when all cancer cells are replaced by normal cells, which is the fundamental principle to treat cancers. By now, I believe you have a clear idea about human body regenerative restoration science. Next, we'll talk about rejuvenation. I have never talked about this topic. I previously dared not talk about it. Now, I decided to talk about it after we discovered the mechanisms of scarring. So how does one remove scars? Scars are the result of the fast and acute fibrosis of the skin organ after trauma, while the aging of the internal organs is chronic fibrosis. With the relationship of the acute and chronic fibrosis as our research model, we discovered the mystery of rejuvenation based on the mechanism of a skin scar. It is true that everyone can rejuvenate, because we are all experiencing premature aging. In the future, 100 years will separate one generation from the next. Maybe at that time, rejuvenation may not be necessary. People at that age do not need this process of rejuvenation. With the disappearing of scars, we get rejuvenation. This is our model. Stemmatic cells in the scars were transformed into stem cells to rejuvenate scars. This is really true, I swear, though it is unbelievable to get the stem cells from somatic cells from a scar. Recently, the result was repeated and verified again in Hunan Medical University, one of our clinical research bases, and also in the People's Hospital of Hunan Province using the same procedure. I said they are the first batch of repeaters. Rejuvenation is achieved with removal of scars through the transformation of stemmatic cells into stem cells. See this picture? Such a large scar on the face has disappeared. Imagine that a small scar in a heart with a mitochondrial infraction accompanied with CHD. It would be much easier for it to be regeneratively restored. Until now, both lung fibrosis and liver fibrosis can be regeneratively restored and rejuvenated. This is no longer new and has an application history of more than 10 years. Now the National Medical Network of MIBO has included this part as routine therapy. Now we come to external organs. Our human body organs can be divided into internal and external parts. See these pictures of external body? Do you see the difference? Is it rejuvenation? On the left is a face at 55 years old, while on the right is a face at 60 years old. Is the appearance on the right much younger? Of course, cosmetology can make our skin finer and smoother, but the regenerative restoration of external organs does not only mean that of appearance. What we do is rejuvenate the whole face deep into the muscle level. This is rejuvenation of external organs. You can see our technology has lifted up all the muscles in the face. The frontalis became tense, so did the eyebrows. When you are old, your muscles will be flabby and droopy. The person looks more spirited since her eyebrows have been lifted. Have you seen my pictures just now? Have you seen them carefully? Look at my eyebrows. They were droopy 5 years ago and they are lifted now. Look at this picture. Which part of her cheekbones became higher? The cave part is now elevated. Now the muscles in the cheekbone are elevated to the original position. See her ears, just like facial muscles, will drop as her age increases. The ear is in the left picture has drooped. See closely. The ear in the right picture have been lifted up compared with the left picture. Also, the muscle in the ear is lifted up. Look at the muscles around the mouth. They have been lifted up and constricted. As a result, the nasal lip line is also lifted up. We often say a smile makes a person look 10 years younger. Indeed, a smile can make us look much younger, though our age cannot be reduced. When we are smiling, the nasal lip line will be lifted up just like this. So after the regenerative restoration of external organs, this person will look much more younger when smiling. Aged muscles are droopy and flabby, while young muscles are tight. I believe you will be very interested in the regenerative restoration of facial muscles. After all, we all want to be young. We are born young, and so we have the potential of being young. Look at my pictures. This part cannot be matched. Why? That is because the muscles in this part have changed. However, there is a part of our face which will never change, the nasal bones, which are hard. Based on the nasal bones, we can observe these changes. Just now you saw Mr. Liu. He is more than 60 years old. Can you believe it? He looks like a young guy and is so energetic. He is also a volunteer in my club. Once I told him it was not enough just to see and listen to my science, but he must also experience it. If you do not experience it, you won't believe it. Even if you believe it, you are not a scientist, since scientists have the characteristics of digging out the deep truth. So finally, he was persuaded to join my club. So you see, there are changes in the past years. Many media fellows know what I looked like in 2007 when I was given a news press. I am sure you can see the differences between what I looked like then and now. Okay, so much about the rejuvenation of external organs. All the body muscles are just like the facial muscles. With the increase of age, they will become droopy and flabby. Many of our volunteers are glad to say that they are very satisfied with their present situation and that their muscles are becoming more tense and constricted. These are the results of external organs. Okay, next we talk about the rejuvenation of internal organs. The internal organs are not easy to see. The organ that is the most convenient to see is the gastrointestinal tract. The heart and the liver cannot be seen with a conventional method, but we can find methods to solve this problem. The left picture is an aged gastrointestinal mucosa. In plain words, mucosa refers to villi. The left picture is of aged gastrointestinal villi. The right picture shows the regenerated mucosa. This side is lifeless, while the other side is vigorous. We have seen the comparison of internal organs before and after rejuvenation. Later in this lecture, I will give you a special session to show you the more detailed results about this. We know that some internal and indirect organs are difficult to see, but some technologies such as special imaging techniques, isotope technology, and ATP energy distribution can be used to monitor the rejuvenation of the body's organs. For example, these technologies are used to look at whether the blood vessels are blocked or not, or to see whether they are open or not. These will be addressed later on one by one. Well, let's see how the regenerative restoration of the gastrointestinal tract is achieved. When our ongoing human regenerative restoration and rejuvenation study, which is currently in its first 5-year period, reaches the 10th year, we will announce more exciting results. First of all, we summarize the regular pattern. The procedure is from sub-health to health. In our study, patients in a sub-health state improved to be in a healthy state after half a month. Through regenerative restoration in half a month, the energy, spirit, vigor, and strength are thriving and patients continue to be vigorous. At that time, you will be able to notice a difference in appearance of the patient's eyes. Some changes will take place in the eyes. The eyes become more brighter, fine, and intense. Changes in energy, spirit, vigor, and strength of patients are also evident. Following 2 years of treatment, the whole body will be regenerated and restored, during which you will not get sick. The body will be all in good healthy state. From the 3rd year, you will enter into rejuvenation period. So you see, we only spend 2 years to achieve rejuvenation. According to our research data is this batch. Rejuvenation can be achieved in 2 years, and this process is still continuing and will last for a long time. But as for how long, I have no idea. But based on the results from mice, we can speculate that this process can last for 50 years with no aging occurring to the body. Another group consisting of patients with systemic and intraceable diseases should also be treated by regenerative restoration science. That is to say, these kinds of patients can also be regeneratively restored. Regeneration includes 2 parts. One is the regeneration of healthy organs, and the other is that of unhealthy organs. But no matter what the organ is like before regeneration, it can be regenerated. Unhealthy organs can first be changed into a healthy state and then come into the regeneration stage. But now, even though some diseases have been regeneratively treated, such as high blood pressure, uterine fibroids, and lung fibrosis, which can be restored in about 3 years, we cannot give a defined time to achieve rejuvenation. The law hasn't been formed yet. However, the rejuvenation law and procedures for healthy and sub-healthy people have been established. No doubt the value of human being regenerative restoration science will be very great. So you can imagine how tremendous the value of life regenerative science will be. You know, it will bring a priceless new life and a new world to human beings. However, there is a price for this regenerative substance. Even though the product is expensive now, later on it will cost as much as a breakfast does. With little money, you can achieve rejuvenation.